Frozen shoulder on average will last 9 months. Now remember, this is an average. I'm Dr. Wendy, I'm a physical therapist. I've taken care of women for 20 years, and frozen shoulder is something that happens more commonly in women more than men between the ages of 45 and 60. Now, it's not to say it doesn't happen in people 25, 30 or in men, but it is predominantly in women 45, 50, 60. But you can help it along and help it heal by doing a couple things. Number one, find out what the underlying cause is. There are two types of frozen shoulder, primary and secondary. Primary happens because there is something systemic happening, let's say perimenopause. Estrogen lubricates your joints. Estrogen helps keep your tendons and ligaments elastic, and now that your estrogen is down, and maybe you're also in what I jokingly call thyropause and your thyroid's off, now you have an issue with your shoulder, because frozen shoulder happens in people that have either diabetes, thyroid issues, hormone issues such as perimenopause. Secondary frozen shoulder happens because there's an underlying injury such as a labral tear, a rotator cuff tear, a fall on an outstretched hand, a fracture, something that caused pain and made you begin to limit your motion. In primary frozen shoulder, you want to get to the bottom of what is systemically happening with you. Is it your diabetes? Get your blood sugar under control. Is it your thyroid? Take your medication, modify your diet. Is it perimenopause? You can take HRT, you can modify your lifestyle habits. But systemically helping your body come along. And for both of them, we do want to make sure and rule out that there are any other pathologies underneath that frozen shoulder. Your primary care doc is a great place to start, and I always recommend a PT consult to help you make a range of motion exercise routine at home, because you are the most important variable to your healing. So figure out what else is happening can help speed it up. I want you to figure out what's happening with your blood work and with you systemically. Get your blood sugar under control, get your hormones, get that under control. And then you have to modify your activities of daily living, and you're going to have to do some mobility exercises daily, because you're going to have to help that shoulder loosen. Notice I didn't say PT was the number one most important thing. You are. PTs are important, but you are the most important thing in your healing of your frozen shoulder. Of course, orthopedic doctors can give you an injection of steroids, and I am for steroids. I'm also for a steroid pack, but no matter what you do matters most. And if you have frozen shoulder and you have thyroid issues, diabetes, your perimenopause, menopause, and your shoulder's freezing, is telling us at the chemical cellular level something's off and we need help. So I respect the body sending up a red flag and saying hey, hi, pay attention, something is happening. I love to listen to my patients, because if you listen to your patients, they will tell you what's wrong. With frozen shoulder, if you can't recall anything that you've done, it might be primary. If you recall falling on an outstretched arm, falling down the basement stairs, and then it started and you started to guard, might be secondary. But please don't suffer alone. If you want it to heal fast, make it go away in 9 months, you're going to have to facilitate the healing process. Facilitating the healing process looks like getting a diagnosis, chemically healing the body, and changing your habits and mobility.